Hi, everybody. This is Rob Packard from Medical Device Academy, and today's webinar is on how to have a more effective management review. I've done this webinar before, but we updated our slides. We added some new material. I see after going through it, I have some opportunities to maybe even update it further, but I think I'm going to wait until we go to an EQMS system and have even more to show you. But for the next year or so, this is what I think we're going to have for training. The procedure, I just did a live session on how to make that procedure yours, but this is the required training for your top management. So they know what's expected in a manager review. And all they got to do is watch the video and they can have a drink while they're at it. It's okay. I said so. They won't be operating any heavy machinery while they push the YouTube button. Okay, here we go. No, number one, goals of this webinar. Avoid any nonconformities in your management reviews. So when you're audited by a notified body and the SAP ISO certification body, or you get an FDA inspection, you don't want any findings. That's number one. It's not always possible, but that's the goal. Number two, you want to improve the process efficiency so you don't have any people in your top management complaining about what a waste of time it is. You don't want to put people to sleep. You want to jazz it up. So if that means throwing snack-size Snicker bars at the people in the room, that's sometimes what you got to do. And number three, add value. That is my bottom line. I don't like to write audit findings that add no value. I can tell them verbally, you should do this. If it's something that really is going to add value, I'll write it down. But if it's not going to add value, why am I wasting their time making them open up a CAPA for it? Same thing with the manager review process. I don't want you to do things that are a waste of time. I want you to do the requirements, and I want you to do them well, and I want it to have a meeting that's run efficiently and you're proud of and your boss is impressed by. That's my goal. And it has to impact the bottom line, otherwise it's not value added. So, management commitment. There are 5 pieces to this. One of them is top management has to establish a quality system and maintain its effectiveness. Number 2, you have to meet the customer requirements and the regulatory requirements. Number 3, you have to establish a quality policy and quality objectives, and you have to review those in every manager review and update them if needed. You have to conduct manager reviews, and they have to be scheduled. That means in advance, not an hour before. And ensure available resources. So you can't say, well, I don't have enough people. I didn't have time. That's not an excuse. Get it done. How can you show commitment? Number 1, this training is required for every manager and top management. That would be one way. So by you watching this video, you are showing commitment. Number 2, assign one quality objective to everybody. Now, that might seem crazy. Like, why would everybody have a quality objective? You're supposed to establish quality objectives throughout all levels of the organization. If you have no measurable objectives for your job, nothing important that I want to measure, why do I hire you? Think about it. You know, Peter Drucker said, what gets measured gets done. Do that. Measure it. Have the employee measure it and give it to you in a graph once a week. They're not going to put down bad numbers if they have to give it to you in a graph. I learned that very, very early on. I was able to manage a quality manager that was doing a horrible job of keeping up on receiving inspection. I said, look, we have over $1 million of inventory that I need inspected. If that number is not under $100,000 by this date, you're fired. I want a graph in my inbox every week. I'll show you how to create the graph, and all you have to do is update the number. The way you get the number, talk to the purchasing agent over there and ask them what the inventory turns are in that location, the place to be inspected. So we got that number, put it on the graph, send it to me once a week. That's all he had to do. And guess what? The number kept on going down and got under the number it needed to be so he didn't get fired. It works. Use management reviews for business planning. That is one of their purposes. It's supposed to be best practices in how to run a company. It's supposed to be value added. It's not supposed to be just a waste of time for the FDA or ISO inspector. That's not what it's for. It's for to run your company so you make good product. You run things consistently and efficiently. Now, The quality managers, they all say, well, it's just lip service at my company. Well, as the top manager that's watching this video, do not take that attitude. Take it seriously. Give your management rep a little bit of respect and you'll get something back. You'll get a company that runs smoothly. If you give them no respect, you get Rodney Dangerfield and you get what you get. Customer focus. The focus needs to be on your customer requirements and the regulatory requirements. Some people even say one of our customers is the regulator. So yes, you need to comply with those requirements. Top management should ensure that customer requirements are met, but you have to have them written down to know what they are. So write them down. Those are requirements. Those are your design inputs. Shareholder, stakeholder, whatever it is, those are requirements that you have to meet. ISO 9001 says the aim of enhancing customer satisfaction. That's not the same as 1345. If you have both, you're going to have to do both. But the aim of 9001 is enhancing customer satisfaction versus ISO 1345, which is safety and performance of medical devices. We're trying to maintain safety and performance, not improve continuously. So the two tenets of 9001 that are different from 1345 is continuous improvement in customer satisfaction, whereas in medical devices, it's safety and performance. So the first thing I always think about when somebody's asking me to do something I'm not so sure about, I say, is there any safety concern here? That's a good policy. When somebody's asking you, should I recall this or not? Is it unsafe? If the answer is yes, it's unsafe, recall it. Stop thinking about the money. Safety first. Yeah, you don't want to have to tell somebody why their husband or wife or child died. Yeah, safety first. Customer satisfaction and customer feedback, those are two different concepts. Customer satisfaction is a survey that we send out for 9001. Customer feedback is a much more detailed set of questions that may or may not be in the form of a survey, probably involves multiple inputs, and is focusing on the risks associated with your product, which are safety and performance. The quality policy. Have a quality policy shown in your slide deck and redline it. That's my recommendation. If you don't have any changes to make, say no changes. Simple. Anybody think we need any changes? Nope. Okay, next slide. You need to have in your quality policy a commitment to comply with regulations and customer requirements and maintain effectiveness. Those are the requirements. Customer requirements, regulations or regulatory requirements, and maintain effectiveness. If it doesn't say those three things, I have people revise it. Do I usually write up a nonconformity for that? No, not usually the first time, because it's not adding a lot of value. It's a statement saying what your commitment is, but it's not going to directly impact safety and performance of the device. So I generally say this isn't what they mean. This is the right way to do this. If they don't have a quality policy, here's your nonconformity. But if you have a policy and I'm arguing over the wording of it, come on, that's not value added. Quality objectives. I want to measure things that are important. Management decides what you measure. When I measure these things, I want a graph. A sign of a good change that I make in the company is when things become more under control. So I had it running at one level, I made a tweak, and I can suddenly see the shift. What I'm showing you here on the screen is a run chart. Maybe we want to be a lower number. Maybe we want to have the process running at a lower number. Maybe we don't. It depends on what your measurement is. Are you measuring scrap rates? Then you want it as low as possible. Are you measuring satisfaction? You want that as high as possible. Two very different things to measure. So depending on what you're measuring, you have a different graph axis. But when you make changes, you should be able to see the impact in the graph, or you're not measuring the right thing, or you didn't change the right thing. And you want it to be consistent with whatever your quality policy is. So whatever objectives you establish, they should be linked, in the quality policy really sets the framework for your quality objectives and metrics. Everybody is required to have a quality plan. A lot of people get confused and think, oh, my manual is my quality plan. No, it's not your quality plan. When you establish the quality manual and established the quality system, you came up with a plan. Then you executed it, and when you do the quality measurements, the quality objectives, and you have audits, that's checking the quality system. When you implement CAPAs and have management reviews where you take action items, that's acting. And when you revise your quality plan, that's coming up with a new plan. So any changes, you need a new plan. So that's quality planning. It's the plan, do, check, act cycle, and it's one of the core principles of quality management systems. It doesn't matter what quality system we're talking about. They all have it. Responsibilities and authorities. There are two pieces to this. Number one, your quality, usually you have an org chart. That's why I use that symbol. Your org chart would define who is responsible for what areas and who they report to. So do they have the independence and authority? In general, it's not absolutely necessary for your quality inspectors to report to the quality department. They can report to manufacturing if they are measuring something objective. That's key. If I'm measuring something objective, quantitative, if I'm measuring a dimension, is it 4 millimeters? Is it 5 millimeters? That's an objective measurement. If it looks pretty, that's where we get into trouble. There are ways to handle subjective things, but in general, when your quality inspectors are responsible for objective measurements of things and objective sampling plans that are statistically driven, you don't run into problems because they only have to measure things according to a specific written procedure with specific written methods according to an objective measurement criteria. So it's okay in those cases. They don't need independence because there's nothing subjective about what they're doing. The person says, well, do you do that measurement? Yes, I did. Here's the record. Was it in spec? No, it wasn't. So why are you asking me? This isn't subjective. It's scrap. Or it's not. So that's how everybody has to be in a company that develops medical devices. You have to be very objective. If it is a subjective thing, such as auditing, that's when I have to make sure I'm not auditing my own work. So if it's a visual inspection of something cosmetic, you might need to have some independence. But if it's measuring what the thickness of the plastic is, it doesn't matter who measures it. It just means they need to be trained with calibrated gauges following a procedure. That's it. The responsibilities and authorities are defined and documented in your procedures or in your org chart or both. And the regulations require nomination of specific persons for post-production activities in adverse event reporting. So what we're talking about here is the complaint handling unit, who's the responsible person if you're in Europe, the manager rep, person with regulatory responsibility, person that signs the declaration of conformity. Yeah, that's who we're talking about. So typically that's the management rep. So you don't typically have the management rep reporting to the production supervisor. You normally have them reporting to one of the top management. And oftentimes they're part of top management, but it doesn't mean they always have to be reporting to the CEO. It's okay to have them reporting to VP of Ops. It's okay. We'll get over it because the VP of Ops, if they didn't get to VP of Ops by saying, well, we won't worry about that quality stuff. They got to VP of Ops by saying, well, this is about safety and performance. So let's set an objective, quantifiable criteria and put it in writing and make sure everybody follows it. That way, I don't have to have these discussions about whether it's okay or not. The VP of Ops doesn't want to discuss whether the part's good or not. Neither does the quality manager. It is or it isn't. Keep it objective. Management rep. Okay, you have to define it. I recommend including it in the procedure, including your org chart. That's all you got to do. You do not need a special memo. If it makes you feel better to write a special memo, you go right ahead. You write that memo. It'll make you feel better. But org chart, manager review procedure sounds good to me. You could even say in the manager review procedure that the manager rep will be defined in the org chart with the following asterisk. Sounds good. Then you only have to do it in one place. And I will show you where I do it in a couple slides here. But ensure that the management rep makes sure that we establish a quality system and we maintain it. They report to top management. They schedule the management reviews. They make sure they promote an environment in the company where we're about safety, we're about effectiveness, performance of the device, instead of letting people worry about money only. That's not the right approach. Who are customer focused, regulatory commitment. Those are the things. Customer focus, regulatory compliance, that's what we need. And the requirements for internal communication, how you communicate internally, communicate who's the manager, communicate the quality policy, communicate the objectives, that's in 5.5.3. For the management review, you got to schedule it at planned intervals. You can do that in the management review meeting. When's the next one going to be? That meets the requirement. Next, ensure that it continues to be suitable, adequate, and effective. That's the quality system as a whole. Next, assess the opportunities for improvement. Do we need to improve this? Make sure you look at the quality policy. Does that need to be improved? Do the quality objectives need to be tweaked? And you have to maintain records, and you need to know where you put those. Now, this slide, I think this is probably the last time I'm ever going to have this slide. The next time, we're just going to forget about FDA inspections, and we're going to be focusing on ISO 13485. Why? Because the thing that everybody's always been saying is, well, FDA inspectors can't see our management review meeting minutes. They can't see our internal audits. They can't see our supplier audits. But they can get to all those things through the CAPA process. So those are exempt records. My suggestion, when an FDA inspectors ask for those things, you don't say, well, you can't see those things. It's like poking the bear. Instead, just say, this is a record that's one of the exempt records, but we have nothing to hide. Here's a copy of it, but you can take all the notes you want, but you got to give me back the copy because you can't take a copy with you. Fair? Fair. Now, they can get through it through MDSAP program. They can get through it through ISO 13485. They're going to be able to see it in February 2026 when we go to the QMSR. And so get over it. They're going to get to see it. They're going to see all those CAPAs that you've implemented anyway. That's where all the big problems are, the nonconformities and CAPAs. They see those anyway. And they can see your cage full of scrap parts from the supplier. So what is the big deal? Let them see it. But you don't want somebody like Del Griffith there that's friendly and talk. You know, what was the question the FDA asked? Smile, answer the question, give them the record they want. Then sit there, smile. What else do you want? I'm here to help. Just tell me what we're not doing right, and I'll open up a CAPA right away. That's the right approach. Be anxious. Like, this is the first time we've ever implemented a quality system here. We're sure not everything is perfect. If you identify something we need to improve, let me know about it, and we'll write it down. We'll open up a CAPA before you even leave. That's the right approach. You got nothing to hide. That's what you want to convince the FDA of. Not, we have all these things we don't want you to see about our supplier in this country. No, not that way. Manager review inputs. There are 12 items A through L. You do not have to do them in that order, but whatever order you do them in, I recommend using a template with those clauses identified in the title of the slide, so you know what clause that slide is addressing. So the auditor doesn't have to guess, oh, this meets that requirement. You want it to be very clear. Use a template, put the clause number right on the slide. Little parentheses in the corner or at the end of the title. That's all you got to do. Little, subtle, just enough so the auditors, oh, that's how they did this. I don't even have to ask the question. I get it. I'm looking for 5.6.2a where, oh, there it is. Feedback. Don't make me, well, you called it post-market surveillance, not feedback. Just put 5.6.2a next to it and I'll get it. For the feedback, this is, and I'm going to go sequentially through this just because it's easy to design a slide deck that way. But this is one of the most important areas for you to cover. Why? Because Europe is making such a huge deal out of this. They added a whole new section to the regulations. They want a new section of the technical file for post-market surveillance activities. And ISO 13485 has feedback in it. You can guess that there is going to be some emphasis on post-market surveillance now that it's going to be required as part of the QMSR, and it's not currently a requirement for those Class 1 and Class 2 devices. It's only a requirement for Class 3 devices in the US with 522 plans. So maybe you want to bone up on what is required for post-market surveillance. Also, your post-market surveillance program is supposed to be a way of verifying that your risk estimations are accurate. you're supposed to continuously update your risk management file, and you can't do that if you're not doing post-market surveillance. So that's one of your reasons. You're supposed to do trend reporting. You're supposed to do PSURs. So a lot of this is Europe related, but we got stuff down here in the MAW database, device registries for implants, journal articles. You want to see what publications are out there, what clinical studies have been done on your product. Maybe some of those will be helpful in marketing. But if you want to know how to do this, the best place to go is this standard, the AAMI ISO TIR 20416. It's a guidance document on how to apply post-market surveillance to medical devices. And if you want another source that's free, Health Canada has a great guidance document. I believe it was June of 2021. It was implemented. The requirement, and it actually, I think their deadline was December 31st of that year. So, but the requirement was that they would have reporting of foreign changes, or I forget what the exact title is, but basically anything that happens outside Canada, we want to know about it if you sell the same products here. That's the same policy the US has, same policy Europe has. So they made it a law, and they created a really good guidance document. And the requirement for the PSUR in Europe can also meet the requirement that they have for Health Canada. So you might want to look at their free guidance on that foreign reporting of trend analysis, and it might be just the right approach to your post-market surveillance program. For complaint handling, this is requirement B, your second requirement out of 12. How many complaints do you have is a really good thing to be asking. What is the percentage of sales volume? Why do I have this in there? Because that's required for Europe. They want the last 5 years of sales. So it's a really good idea to know what percent of your sales. They also want to know what your competitors are making a lot of times, so they can compare with apples and apples of other companies. So that's good to have, but you might not have that information. But you certainly can tell them what percentage of your own sales the complaints are. You want to indicate how many of your complaints are open. You should be closing them in a timely manner. It's one of the few places in the quality system regulations where timeliness is a requirement. They should be closed in a timely manner and consistently, with a very consistent process. So make sure you do that. And if you make this a quality objective, how many complaints, you may have no control over. How quickly you close them, how timely that is, what percentage are open, what percentage, how many are open, what length of time they're open, how consistent the process, you have control over that. How many as a percentage of sales and how many total complaints you don't have direct control over. So that's something you got to be aware of. Don't make an objective that you can't control. That's dangerous. Reporting to the regulatory authorities. Once again, percentage of sales volume. How many are open you can control, not the percentage. How many you have is an objective measurement, but you can't set a quality objective for that because you can't control it. Were all the reports submitted by the deadline? That you can control. So you want to organize it by country and you're reporting it to the top management. Great idea. But don't get hung up on an objective of we're going to only have zero reportables this year, because you can't necessarily control it. It's a great goal. Doesn't mean it should be a quality objective. For audits, you have first-party audits, second-party audits, and third-party audits. You should be reporting on all three. You should indicate what the schedule is, and you should look for any areas that are going to be a problem where you have too many audits occurring all at one time. The supplier audits, in particular, with a lot of suppliers, you can have a lot of supplier audits. Supplier audits aren't always required, but they're certainly a recommended solution if you're having supplier quality issues. And if you're having any kind of complaints, non-conforming products, something like that, see where your problems are coming from. They actually want you to analyze your data from audits and figure out where your problem areas are so you know where to spend more time for future audits. For the monitoring process, so this is a requirement to monitor and measure processes. So any process can be measured, including the management review. It's just an example. It's the best source of preventive actions. You see variability, you want to reduce that variability. Those would be preventive actions. So use metrics to identify preventive actions. And you can also use the quality objectives for identifying corrective actions. But before it's become a nonconformity, those are preventive actions. And so I gave you some monitoring and measuring in the process that might help you. But think of monitoring and measuring for all the other processes and what preventive actions those might lead to. For product, you have NCRs. That's going to be a metric you're going to measure. So that should be part of your production and post-production information that you're required to have as the last item, clause 10 in ISO 14971 2019. You have to have that. If you have a lot of products, you don't need to review all the trends all the time, so you could stagger them. You could say, well, we're going to have 3 or 4 meetings a year, so we're going to take 1/4 of the products each meeting. That would be an acceptable approach. But you might juggle the schedule a little bit if you have a new product launch. That might be a reason to shake up the schedule. For corrective actions, one of my favorites is, what is the average aging of your corrective actions? And this was a real graph from a company I worked at, and I was the management rep. And all those other managers were the people in the management review, and some of them weren't doing a good job. And we only had 24 days for one of their CAPAs, but we had other people. We had one person with 10 CAPAs averaging 218 days. So they're not doing anything until I nag them and the BSI audit comes. So you shouldn't have your quality metrics all get better around the time of the audit and all get worse as soon as they leave. That's not a good sign. So this is not the graph we're looking for. Preventive actions should be separate from your corrective actions. You should have evidence of true preventive actions. So that's something you should have. If you have no evidence, that means you're not doing enough monitoring and measuring and analyzing that data. This is something that's highly underdone at companies. You should emphasize this particular process. If there is a graph or a metric that you're not happy with, then you should implement a requirement for an action item. Hey, you do this. So you tell the person, this is your responsibility. This is what I want done. This is when I want it done by, and this is how I want you to monitor it as a quality objective or a quality metric. And this is how I want it communicated to everybody on top management. That's best practice. If you don't have any follow-up action items, you don't have any past action items, maybe you're not measuring the right things. So the two are linked. If you're not measuring the right things, then you're not going to have the right action items. In the way you indicate the success or failure of them or the status of them: green light, yellow light, red light. Red light means you're not compliant. Yellow light means it's in progress. Green light means it's done and it's complete and successful. So simple way of articulating that. A suggestion: you do not have to use spreadsheets. You do not have to use Word documents. There are better tools out there, like this one. I'm not getting money from them, but I use their product all the time. And you can see we have weekly tasks and sprints for our company. And we're doing some things to try to improve our website and make it easier for you to find the information you're looking for on our website. And we have action items assigned. We have a meeting every Friday. We sign the action items and we use color coding to indicate what the status of it is. And we can track it. And it has an audit trail. That's what these little things are here in these bubbles. Those are our audit trails. We type things in there and it saves them. And it says when we wrote them in there. And it gets backed up. And I can access it on my phone too. Changes that could affect our quality management system. So if there are any changes, a new product launch, adding new people, letting people go, acquisition, being acquired, downsizing, whatever it is, those are all things that are going to affect your quality management system. But in particular, one of the classic things that cause a quality system to go belly up and not perform at all is the manager rep left. And it's kind of funny, about 6 months before they leave, it all starts going to crap. So if your quality system is suddenly not performing quite the way it was, are you treating your management rep well? Are they looking for a job? Just saying. I've seen it enough times to be able to predict when they're looking for a job. So you might want to look at that. I highly recommend having a transition plan when you find out somebody's leaving, who's going to be responsible for all the things that person was doing. So exit interviews and exit strategies, transition plans are really key. That should be a quality plan all on its own. Recommendations. So at the meeting, you want to have managers make recommendations for improvement to make the quality system better. So every manager in the company should be able to come up with at least one suggestion for improvement, or they are not a manager. Nothing is running that smoothly. There's no suggestion for improvement. We're just perfect here. Yeah, not going to happen. These could be possible preventive action. Could be. It might be something I think we ought to measure this to see if it's under control, and if it's not, we'll take corrective or preventive action. Good plan. And these could be manager review action items. They could be CAPAs. They could be quality objectives. They could be all three. So you decide, but recommendations for improvement. Newer revised regulatory requirements. So if you happen to know a date that the QMSR might be coming into force, you might want to have a quality plan already in place for that. And you might have want to bought mine and copied it, because why create your own? You're not going to be able to do it for cheaper. Buy the QMSR training and copy my quality plan and come up with a little tweaks to it to make it better for yourself. Good strategy. You don't have to do that. You can come up with your own. If you really love creating quality plans and you really want to go by that standard, you want to read the whole thing and follow it, you go right ahead. But you should have a quality plan for new and revised regulatory requirements. So when one of those standards change, you should have a plan. And it should be in writing. And it should have action items, and it should have who's assigned to them and how often you're going to monitor and measure that plan. As I said before, you could use money.com as one of the many project management tools out there you could choose for to track all those items. But in your manager review meetings, you have to keep records of all those things you had in the meeting. And those meetings are an output, which is the next section we're going to. You could type all that stuff. You could have a scribe. You could also spend a little bit of money once a month and get Read AI. I use it for my team. So try using that. And here's just an example of our real meeting minutes from last Friday. So this is, I took little things out of here that wouldn't be appropriate because they had customer's name in there. So I took that piece out and I took this piece out. That's what you can do in your manager review. You have Read AI record everything, and then you take out the things that would not be appropriate for meeting minutes. Do a little bit of editing and take out the things that you wouldn't say in front of an FDA inspector. You wouldn't say, we sometimes are a little casual about things. Maybe we shouldn't be so casual in our meeting minutes, but the work that's required to delete things is far less than the work required to remember what I said and type it down. So use this tool and use it for your design reviews while you're at it. In CAPA board meetings, yeah, those two. Be a great idea for all your sales team to have it too, so you could record customer calls. Just an idea. Never know. Manager review output. So your meeting minutes is the core output, but the elements that you have to have included in those meeting minutes, one of them would be improvements needed to maintain the quality system, improvements to product. So that comes from your post-market surveillance. What ideas do we have from customers to improve the products? Changes to the quality system to maintain the effectiveness of it or meet new and revised regulatory requirements, and resource needs. Those are the four things that have to be in the outputs, plus your manager review meeting minutes. That's minimum. Those four things. Improvements to the quality system, improvements to products, changes to the quality system to meet new and revised regulatory requirements, including an action item, and then resource needs. Done. And don't forget, resource needs is people, training, and equipment. So now we're going to cover each one. The first item, improvements needed. So the improvements needed, especially, and I've put this down here, and I'll put on my little highlighter again here. So especially those from clause 5.6.2K. So if you want to know what that is, you go back to K, HIJK. These items here on this slide, those should be especially the items that are covered here. And you might not agree with all of them, but the ones you agree with, make sure they're here. Any new action items you've discussed, the management review, who's responsible for them, how often they're going to report them, if there's a quality objective, if you're going to open up a CAPA, yep, that has to be in there. Next, any improvement of products. So customer feedback, non-conforming material, those would definitely be captured. So you go back to 5.6.2a and 5.62f. Do we have anything from those slides? So if people are can't remember, I don't remember what improvement of product we were talking about. Go back to those slides, 5.6.2a and f. Go back to those slides, find out what they are. Those are your action items for the outputs. The next one, a quality system plan template. I give you one. Here's a screen capture of it. I created this in February when the FDA released their QMSR plan, and it's all about the implementation of the QMSR. And it has the date in there that they're going to implement this and what your deadline is. So you need to implement that. So you should be doing that in 2025 for 2026. Yes, the time is flying. This is a 2025 plan. You should be doing this now for next year. Plan for all of next year. This is the plan we're going to implement. So it's all in place before the end of the year. Do not wait till the last minute. Do not wait until after you get the nonconformity. Just a waste of CAPAs. Resource needs, new hires, temporary or permanent, doesn't matter which, could be consultants, whatever it is, any training, in-house, external, whatever you have, maybe this training for your top management, equipment and software. Don't forget software is capital items too. You can spend $10,000 to $50,000 on software in a heartbeat. And then the work environment. What do we need to improve here in the work environment? That was something I didn't mention earlier, and I should have. That's an important one. See, we forget stuff, and that's why we do these trainings. So work environment. Do you need more space? Do you need less space? We can close that warehouse. We don't need it anymore. Oh, we're bringing in a new product that needs to be sterile. We need a clean room. We don't have one. Those are examples. Maybe you're going to be doing some metalworking that you weren't doing before, and you need someplace to store those metal shavings. Maybe you're going to be working with something hazardous and you need special safety controls for that. Whatever it is, you need to make sure you have the right work environment. You're making electromedical devices, you need to be doing soldering. You're going to need ESD controls. You're going to need special wrist straps, gowns, a whole entire ESD training program for people. Yeah, that's a real thing. A checklist. Oh, auditors love their checklist. Quality managers love their checklist. Here's your checklist. I created your checklist for you. You can use this checklist. These are the things that you should have. Did you cover the effectiveness of the quality management system? So you should have a statement in your quality template says, or manager review template says, was the quality system effective? You should have that conclusion. Yes, it was, or yes, it was, except for the following action items or CAPAs that we are going to open. That's also a good answer, except for the CAPAs we opened in this meeting, or for the action items we opened. Quality policy remains effective, or quality policy needs to have the following changes to stay effective. Quality objectives, keeping them all as is, making changes to the following ones. Didn't hit that one, going to add additional resources to make sure we don't do it again. Manager responsibility and authority, we're establishing, oh, yep, you're going to be the manager rep for the next quarter. You're going to be responsible for scheduling the meeting. This is the date we're having the meeting, and we've already decided who's responsible for what slides. You might even say, I'm going on vacation. Oh, I'm getting married, and I'm going to be in Aruba for 2 weeks, and I'd like to have somebody keep the stuff running. Can I bring in a trainee? I've got somebody that's a quality inspector. I think they would do a great job. Or, there's that quality engineer in the purchasing department. I'd like to borrow them for a little while and train them so they can be my backup. Great plan. That way you could be promoted someday, or if things don't work out, you can go find a job and the company won't shut down. So works either way. 12 required inputs, A through L, and 4 required outputs, A, B, C, D. Got to have those and the meeting minutes. So webinars that are coming soon. We have next Monday, the 9th, we're doing one on risk management. We're going to explain the procedure and how to adapt that to your quality system. So little change, just like we did with the manager review. That's what's going to be coming next Monday. Next Thursday, we're having a use specification training to prepare your company on how to prepare a use specification. That's the beginning of the usability engineering file that you're required to have for medical devices. That's in compliance with IEC 62366. And this Friday, live streaming, what does GMP exempt mean? So that's going to be in a little less than 4 days because it's afternoon now. So 12:30 Eastern time on the 6th, this Friday. If you want to know what's coming up, just check out our webinars page. And we also have webinars on our 510K course page that are available on demand or sometimes going to be coming up soon. So check them out. If you have something specific you want to talk about that's confidential, schedule a meeting with me or contact Lindsay Walker. Schedule a meeting on our Contact Us page. You have my email, my mobile and WhatsApp number is shown there as well. And then we also have our YouTube live streaming. Check that out. Every Friday we do a live streaming, and time to time, like right now, this is live as well. We stream on Facebook, LinkedIn, and YouTube. So see you 12:30 Eastern on Friday. Bye-bye.